Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Our next guest is Jeremy Ning. He has over 10 years of clinical leadership experience in the healthcare industry, spanning radiology, cardiology, and vascular surgery, under various roles, including lead sonographer and technical director. In addition to being a fellow of the American Society of Echocardiography, he is ARDMS board certified in echocardiography, vascular, and general. He is also project management professional certification under PMI. He has a bachelor's degree in cardiovascular sonography from Grand Valley State University, as well as a master's of business administration degree from the University of Illinois. Cardiology manager at Ann Med Heart and Vascular Center in Anderson, South Carolina, and is passionate in promoting ergonomics, education, and sonography professions awareness in this community. Please help me welcome Jeremy Ng. Jeremy has a wide range of experience in cardiology, vascular, general. He's a lead and now a manager of a department, and he is coming to us today to talk about the topic of AI and the future of ultrasound technology with AI. Welcome. Thanks for coming.
Thanks for having me.
Awesome. So this is such a new topic. Now, I'm in high risk OB and you're in cardiology. So I know we have one little button that says AI that helps us get our pictures. And so we don't have to hit acquire because it will automatically acquire as long as we're getting the picture with the standards of that image that we need, right?
Mm-hmm.
But how has that been different in cardiology?
Yeah, for cardiology, basically, there's a lot of advancement recently with AI. For example, like you say, we have um, the measurements, the auto measurements, where the machine will be able to detect the picture you are in and immediately bring up the measurements that you need. So that will save a lot of time with button clicking. Those few seconds is going to add up to minutes over the whole protocol. Another thing that they have right now is just standardization of readers. So they have a cloud-based company right now called AI NOS that they send all the measurements and all the pictures to the cloud, and it is being interpreted by AI and sent back to generate their report and their measurements. So that is still being tweaked and perfected right now, but it is still something that we are looking forward to in the future. And also when it comes to measurements of the LV, the Simpsons biplane, a lot of them now they AI is able to better detect the endocardium and be able to better quantify the data. And with that, that will hopefully reduce the amount of interuser variability with measurements. I think, yeah.
So is that across the board as far as measurements for all modalities or just cardiology?
From what I'm seeing, cardiology has the biggest advancement when it comes to AI, just because of the widespread use and the amount of interest generated from that. AI has definitely a lot of growth when it comes to the measurements and the views, and not just that, just the volume rendering, and all the different things that they use. Even right now, they even have the ability, and they are researching right now about how they can. One of the biggest issue with ultrasound is to have artifacts and to have suboptimal image. What this AI can do is to patch up those artifacts and reconstruct suboptimal image to produce a very good image that is rendered from that. And that is something that is in the works right now. It's going to be huge.
Oh,
Um, yeah, so I think that is something that can be applied across the board. But as of right now, I think most of them is to do with strain imaging, with volumetric measuring, and all the different things that is being working with AI. So I think cardiology has the biggest AI advancement right now.
awesome. So then how do you think AI has impacted the ultrasound world in general then? What do you think is the biggest impact?
I think it's way too early to tell because right now is basically the wild wild west in the ultrasound world when it comes to AI. But I do have a couple of predictions that I can make, safely make. I think that AI is going to be here to stay, and I think AI is going to be part of our workflow in the future. And I think that AI is going to greatly enhance the tech workflow as well. Um, and also from a QA standpoint, I think AI, if can standardize measurements because that is the one of the biggest issue in the ultrasound world is that it's very difficult to be consistent and if you want to do a comparative studies between from the previous study to the current study if it's a different tag even if it's the same tag the measurements might be different. So I think having a very standardized way of measuring using AI as the common denominator that will eliminate the variability that is persisted in the ultrasound world.
Yeah, but isn't that dependent on the kind of image that you get?
Yeah, and that's where
Right.
the image fixing and that's where the AI can also enhance and make sure that the image are being standardized. There's even right now tools that AI that the ultrasound machine are being incorporating, which is like telling you where is the most optimal place to place your probe at. And they'll direct you as you go, and and they will say like, okay, this is not the most direct angle. Maybe you need to move down a rib space, or something like that. So that will also facilitate with getting the most optimal picture.
So they're telling you how to take the picture then.
Yeah, they actually did an experiment, which is interesting. Well, a lot of techs feel threatened by that article, but I don't think it is AI will replace sonographers. I think it will greatly enhance and reduce the amount of redundant workflow. So that study they use AI to direct nurses to scan a patient with just very simple protocol, and the nurses are able to complete the study very successfully. And that is something that can be deployed in rural hospital where they have no access to direct care.
Ah, nice. Okay. Now that's a big impact.
That is a big impact, yes. But they cannot replace the amount of training and the expertise of the sonographer because ultimately even with AI they are not able to they don't know what they're looking at and there's going to be like very complicated cases
Right.
and patients that need an actual sonographer to do the job. But they in rural places where they do not have sonographers, they can get what they can get.
Right. Yeah. So, I'm assuming you're using AI in your lab then?
The only technology we're incorporating is strain measurements. So with strain technology, it measures the torsion, the amount of different movement of the myocardium, and it generates a score, and that's where we use AI to help assist with that. And they usually for echo, we before we take a strain score, they need to do a like a two chamber, a four chamber, and a three chamber, a long chamber, to be able to render a strain. But now with AI, they are able to just auto generate from that.
From just one view or
They
yeah.
can just take one view and they can just automatically generate
Oh,
from that one picture.
wow. Okay. That's
Yeah.
amazing.
Yeah, but that is just the very beginning. That's just the very tip of the iceberg.
Yeah,
And the thing about AI is big data, right? The more data is being fed in is constantly evolving, right? So every day you scan a patient, every data that feeds into the AI is going to make it a lot better. So it's just going to get better every single second.
yeah, yeah.
That's what's amazing about it.
I heard a lecture on it just this past weekend. I was at a business conference and they talked about AI and it is going fast. Like it is being developed quickly. I think it's going to change our world in the next 10 years, for sure.
100%, yeah. Yeah, it is really making quite some impact.
Yeah. Yeah, I think so. And, you know, he asked, the presenter asked before, how many are afraid of AI replacing your job? And I'm like, I don't think so, And then he gave the speech, and I'm like, oh God, maybe I should be afraid. Oh, but,
I
uh,
think we should be more threatened by the likes of portable ultrasound units. Nowadays they are getting technology is getting to a point where you can even have handheld ultrasound doing very, very decent, taking very decent pictures.
right,
And how that translate into POCUS, right? Or
right,
focus.
right.
If you're a trauma one hospital, those are very important. And nowadays, learning how to do focus or POCUS for residents is very important, and is being taught in um, all the different teaching hospitals. So the newer physicians nowadays, they know how to operate a portable ultrasound unit. So I think that may take away and reduce the need for the volume for a DVT, maybe, or
Oh,
a
yeah,
need for
yeah,
as that evolve. But the only thing stopping that is billing, right? How do we bill for services? How do we document that? That is
sure.
the only thing that's stopping it.
Yeah, yeah. Insurance. How can they get their money, right?
Yeah, yeah, yeah.
Yeah. So what do your, uh, what are your predictions about the future of how it's gonna, do you have any more predictions other than, the POCUS or anything like that?
I
How
think
that's gonna make the ultrasound world look or,
yeah, I think there's gonna be a more I would say there will be a lot more focus on the education aspect of sonographers going forward, especially in the future, because if AI is already doing the homework for you, right? The AI nowadays, you don't have to understand a lot of the machine, how the machine is working. You don't even need to know why do we need to adjust the gain settings. Like the newer techs nowadays, the machine does it all for you, right? And with AI, it's going to even make it easier. So I
right,
think the future for sonography is going to be less straining and time consuming for the sonographers. That is a win for us. However, it's going to require a lot more knowledge from us to be able to, now that we can see more things And now that we have better technology, a lot more burden is going to be placed on sonographers to be able to more accurately and interpret and better show what the clinical issue is from the ultrasound, right? Because in the past, like right now, doing a DVT exam, for example, you do the standard protocol, you show where the clot is, and all that stuff. That's fine. That is the acceptable thing to do. But maybe once AI technology is implemented, once we are able to better identify the clot, when we are be able to see the image more clearly, there might be a higher demand that not only we tell them that where the clot is and all of that, but to also maybe determine what the age of the clot is, or maybe even of just telling.
Consistency of the clock, right? Like how
Yeah, the
calcified is
consistency.
it, or is it soft, or yeah.
Yeah, and the burden is going to be greater for sonographers, and the pressure is going to be greater. Yeah.
Yeah, I think so too. I think we're going to go to new levels of diagnoses, new,
Yeah.
just kind of like, when they came out with, oh gosh, I'm going to really botch this up, but where you can determine the elasticity of the liver,
Oh, yes, yes, yes.
right?
Hmm.
Um I thought, oh, that's interesting. I wonder if we could take that technology to say what kind of clot that is, or what, is it a more calcified? Is it a soft one that we can, suck out of there? Like, um, there's a lot of different kinds and ages of clots and tissues and densities, right? That tell us a lot about that disease that's going on in that.
Hmm.
So I'm sure that's all being worked on, but um yeah, I think I'm not as afraid of it, anymore.
Yeah.
And I try to use it more often just to start opening my mind to um allowing something else to help me, right? I think as ultrasound techs, we have these issues with control, right? I don't know about you, but
100%,
right? Like,
100%.
oh no, I can't let a machine decide where I'm going to put my calipers. I need to be able to do that, right? Um, so part of it is just learning to let go and let something else assist me, right?
Yes.
For the good, as opposed to seeing it as the enemy, right? So
100%. Yeah.
yeah.
Yeah, I mean, if you look at it, if you look at the history and the evolution of ultrasound, I mean, we have come a long way.
Oh,
100%. Like, I mean, we went from operating out of water and using the sound and try to look at something and barely knowing what is going on to now having 3D, 4D, and measurements and calipers, and I mean, we have come a long way.
yeah, and I remember we were all scared about 3D 4D, right? We were all
Yeah.
scared that that was going to take our job,
Hmm.
that they were going to sweep this way and sweep that way and be able to reconstruct everything and we wouldn't have a job, you know?
Yep.
So I think anytime we have new technology, there's always like this scare of, oh gosh, it's going to be our demise, but it never is. It's something that we learn to embrace and use in multiple fields, right? I think
Hmm.
at least from what I understand, 3D 4D came out in OB and then it went to GYN and we saw the benefits of that, and then cardiac, it was used in cardiac, and then they just used it in all these different areas that benefited everybody. And now it's a standard, right? Now
Yeah.
we do 3D of uteruses all the time, right? As a standard. So I think it's just a new technology that we just need to learn to embrace, right?
100%. AI is a tool, it's our friend, it's not here to replace our jobs. I don't think there's any risk of AI replacing our jobs. Not in my lifetime that I know of.
Right, right,
The more I do the more I read into it, the more research I do about it, the more excited I am. I know that it's going to do it's going to bring ultrasound from, like the stepchild of a CT exam or an MRI to maybe the gold standard.
ah,
Um, that's where I think AI is going to elevate ultrasound to new heights, just because of how he's going to make it consistent, how he's going to make it more reliable. I think that's the main issue with ultrasound,
right,
right? The reason why is the stepchild of radiology is because, like, okay, well, we can kind of sort of trust what they say, but can we really trust it? Let's do a CT just in case.
right, right,
Oh, I'm not sure what I'm seeing. That's the artifact right there. I don't know. The measurement seems wonky. Let's just do an MRI and see what we get, right? So it is always more like, hey, we're going to do it just as a CYA, or we're going to do it just in case. We do it just as a follow up. But if we really want to know exactly what's going on, we'll do something else.
right.
So with AI, that might all go away. And think
Eventually,
about that. Think,
eventually, right? Yeah, I think it's
I
gonna
mean, think
take
about the
time. Yeah,
implication. Think about the impact it has. That is going to increase the need for sonographers, not
yeah,
eliminate job, right?
right.
Because if it become the gold standard, then instead of ordering CTs, now physicians are going to order ultrasound more because not only is it safer for the patient, is faster and is more reliable.
Yeah,
The reliability is what's missing, the consistency and the reliability, and that's what AI. That's the problem that AI could potentially solve,
right.
and I find that very encouraging.
Yeah, I do too. I think it will lower or reduce our time with patients, right?
100%.
Yeah. So for us in OB world, we have this button that we can push that kind of helps fix our gray shades or gives us a place to start anyway,
Hmm.
gray shades. And I think that's going to be replaced with an AI button, you know, so that we
Yeah.
get that perfect image, right? With a perfect
Hmm.
window. So, yeah. And I think it'll just be fascinating and intriguing to see because everybody's body habitus is different.
Hmm.
Everybody's scan's different. And for AI to really be able to come in and fix that would be awesome, right? That's one of our biggest challenges to overcome, right? Is can I make this image look as good on someone who's 125 pounds as someone who's 400 pounds, right?
Hmm.
So if AI can fix that problem, then it'll fix all of our shoulders too.
Yeah, yeah. And I don't think that's something that maybe AI can facilitate that, by able to render image from artifacts and body habitus. But I also think that the ultrasound machine itself, then the vendors, they are constantly improving. And I think once they keep up with AI and being able to scan better and have better image quality for larger habitus patient, then that will be great, and I think that will come. Like our machines right now compared to 30 years ago is crazy. Like
Yeah.
we can see so much deeper, we can see so much clearer. And imagine like the next 10 years what the technology gonna be like for just machines.
Yes. Yes. I
So I think that is only going to get better. And I think
do.
it's definitely an exciting time to be a sonographer. And I think we are very blessed to be living in this age where AI is now a thing, and there are multiple vendors coming out. Siemens recently, they launched a new machine with brand new AI capability that not even Philips or GE has.
Yeah.
So it gives them a run for their money. So now they have new
Uh,
competition.
right.
So that's what I'm
I,
saying. So there's always going to be
yeah.
competition. There's always going to be new company, new emerging technology coming in, and I think the future for ultrasound and for sonographer is very very bright. And I think there's going to be even more demand as technology get better, not decreasing jobs.
I agree. Yeah. I saw a Samsung machine not too long ago that I'm like, whoa, now this is interesting. Like
Yeah.
I think it's going to be important as we move through this era of technical change that we stay open-minded and curious, right?
Yes.
I think that's our key, to stay open-minded and curious. And I think that will help propel us to the future, right? If you're like, oh, I don't want to learn this, I don't want to do this, I don't da da da, then you know, you're gonna stay in those places, right? So anytime there's a new something, just stay open-minded and curious and see.
And that's why like ARDMS requires us to keep up with our CMEs, right? So that
Absolutely.
we can constantly learn and we constantly adapt new technology. It's not a stagnant field. It's something that is constantly evolving. And if we don't adapt and learn, we are just going to be left behind.
Absolutely. Left behind are just difficult to deal with, right? People who don't want to change or don't want to mentor or don't want to help others along in new technology or learn technology or new ways of doing things, you're just hurting yourself, right? So,
Yes, yes.
yeah. And the people around you, right? And even more so with management, right?
Hmm.
And I think that's the problem. There's so much for management to do. Here we're back on management again, but uh uh there's there's so much for management to do, but then when something new comes in, for them to take the time to embrace it like you have, that's kind of a challenge at times. It's more
It
work,
is. It
something
is
that
challenge because new technology is scary.
right,
We have undergone gone a couple of new technology, and the best way to do it is just hold an open communication meeting and present them with what is coming and tell them why this is great for us and why doing this is going to benefit us, and let them give their 2 cents and acknowledge them, and just say that, hey, just try it out, you never know, and and let give them a sense of agency in that, and that's how people embrace change. It's tough, it's really tough, but that's how we,
yeah,
we do
I
it.
think too, ultrasound techs are we're creatures of habit. I did a
Yeah,
podcast on atomic habits, this book that I read by James Cleary, I think.
I'm actually reading that right now.
Oh, it's so good. It's
Yes, yes.
like it. Yeah, let me know what you think of it. But I did a podcast on it because I think ultrasound techs are kings and queens of habits. And we get locked into our habits and they become our safety, our security, right? Our boundaries that keep us successful, thorough. Um, you know, I mean, I do it. When I type up a report, I check certain things and I double check it again and I make sure this and I make sure, right?
Yeah.
I have habits of reviewing my reports to make certain things are in there all the time, right? I have habits when I'm scanning, like I get this and then I get this and then I'm reviewing. Did I get all of this, right? Um,
Hmm.
so I think they serve our habits serve as our security in ultrasound, right? That causes us to be able to show up in the doctors or to the doctors and say, okay, I've got everything, it's good, or I don't have everything. I got this, but I didn't get that, or I have a question about this, but not that, right? It's our habits are what keep us safe, I think, to some extent, right?
It is, and the reason why a lot of us prefer to stay with what we're comfortable with is just also because there's a lack of consistency and reliability in ultrasound in general. So if we develop a way where we develop a routine where we know what we do works and the cardiologists or the reading physicians like what we are doing, then we will stick with it, right? And then we're like, we're not going to change
Right,
if adapting newer technology is going to change the dynamic I have with my physicians, and now I have to rebuild that trust again,
right.
right? Then I don't know if I want to go through that rebuilding of trust again.
It's a
I don't want to.
vulnerable place to be, right?
It is. It is.
when we don't understand it, then we can't explain it to our physicians, right?
Exactly. Is
'Cause
exactly.
they're not trained on it either, right? So part of it is learning it ourselves, but then being able to explain it to the physicians in addition to that, right?
Yeah, and we have the same kind of challenge we have when we first introduced Strain. We have to hold multiple educational meetings, not just with the techs, but also with the physicians. We have to specifically invite speakers to come in to be able to educate the physicians and give them scientific papers. They have to do their homework. That process alone takes about 3 to 4 months.
Yeah,
um, and they are still learning because the technology, I mean, the criteria is very vendor specific. So we have to settle on the one vendor. So I get it. Change is hard, and especially for ultrasound techs where it's very user dependent. And when we find a safe space where everything we do is validated by the physician, then we tend to want to stick there.
right.
Yeah.
Right. And to be patient with ourselves. I mean, I think there's a lot of self-talk that has to happen within ourselves as we're learning new technology, right? And giving us the space and the time to be able to, right? It's another stressor, another thing for us to have to learn how to care for ourselves while we're making that adjustment, while we're learning something new, while we're, you know, doing the thing, right? This is why travel is so hard, right? Because you go from one department who does it this way, and then you go to another department and they expect that you just be able to jump in and do it, right? And
Hmm.
yeah, I can scan, but I can't scan the way this doc. I mean, it takes months to learn sometimes how doctors like certain things, right?
Oh yeah, some doctors even prefer you use a different color scheme, right? Oh, I
Right,
like it when it's purple. It brings
right,
the gallbladder out better.
right, right. And so some
Yeah.
of those little nuances, I think it's um I think there's high expectation for sonographers as a traveler anyway, to go from place to place and for people to say, "Oh, it's the same everywhere." No, it's not the same everywhere.
No, it's very different. Yeah.
It's very different everywhere, and it takes longer than a week to learn that, right? Um, so that in itself, let alone learning new technology, right? Learning new technology, like you said, will take months, per vendor,
Mm,
right?
yes.
So, giving yourself grace, giving yourself time, you know, doing a little personal homework yourself, learning how to take care of yourself while you're learning something new, right? Learning how to ask the right questions, to the vendors or to the people, right? To really fully understand the limitations. Um, yeah, I think it's a process, right?
It is. It is.
Learning new habits take time, right? Learning new technology takes time. So just staying open-minded and positive, I think this will definitely help save a few wrists and shoulders, hopefully, as we
Yeah. Yeah.
in the uh, adventure of AI, but I definitely am more excited about it after listening to a, a lecture about it this past week. And I too think that it will change our world, and I think it will change it for the better. And
Oh, 100%.
I don't think it's going to get rid of our jobs. I think it'll make our jobs better and easier. And I don't think we'll have to take another registration for it.
No, we don't.
Right? Which I'm super excited about. In the OB world, um, when Strain came out in Echo, everybody learned it, but you didn't have to take another test or
Hmm.
registration for it. But in the OB world, we see more things, and then all of a sudden we have another certification or another test or another something to take,
Mm,
right? And
yeah.
so I don't think AI is going to create that for us anymore.
Yeah.
right?
which is good.
Yeah, which is awesome. Because in
Yeah.
the high risk OB world, I mean, we have several certifications, right? We have
Yes.
our
The
OB, but we have
nuclear.
fetal echo has been the newest
Yeah.
addition. We have a nuchal translucency, we have a
Yeah.
cervical length. Like the fact that ARDMS hasn't created this as a specialty yet is beyond me. I think they're in the works of doing that. So not casting stones, but when you have to hold, 3 or 4 registrations to be able to do this high risk OB, I think it deserves to be a specialty.
100%. I agree. Yes.
But I don't
Um,
think AI is going to do that to us. I don't think AI is going to make us have to take another board exam, right? I think it's just
no,
to
no.
make our job easier and less time, um, and more information for our patients. So it can
I
only get
agree. Yeah. I do have to go in a minute. Um,
yes.
yes, yes.
I
But
think we're good. I think we're
yeah,
good with where we're
yeah,
at.
it's,
And this is awesome. So thank you so much for joining us, and thanks for sharing your insights about AI.
and thank you for having me. This is great that you're doing this for the ultrasound community, and I thank you for doing this.
Oh, you're welcome. Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.